So to be sure we're on the same page, the grant budget is not your organizational budget. The purpose of the grant budget is to detail the cost of the program or the project that you're proposing and to show the funder exactly what their money will pay for. So you're going to list other sources of income for the costs that are not covered by the grant that you're requesting. And so we'll talk about some of those kinds of other sources that might contribute to your project. Now, there are general principles for cost allowability. First of all, costs have to be eligible. They have to be permitted by statute, regulation, or program guidance. They need to be reasonable. So they should not exceed that which would be incurred by a prudent person at the time the cost was incurred. So I'm a bargain shopper. I like to shop around and check prices and get the best deal. And that's what the funders expect you to do. And most entities will have some type of purchasing guidelines. So for example, at the county where I worked, we were required to get 3 bids for any major purchase and then purchase the lowest cost one unless there was justification for not doing that. The item has to be allocable, meaning that it's incurred directly or indirectly to carry out the scope of the grant. So clearly, whatever you're purchasing needs to be an important component of the grant project. It also needs to be allowable, so something that's allowed to be charged by the grantor. And different granting entities will have different kinds of guidelines in terms of what they do allow you to charge to their grants. One of the things, for example, that you have to understand is exactly what are allowable costs. And these can differ based upon the funder. The federal government, for example, has certain items, and I'll detail some of those, that they will not pay for. Other funders, oftentimes, the Kresge Foundation is probably a good example of when it was originally funded, they like to pay for bricks and mortar. So the Kresge Foundation, for example, has paid for the Kresge Eye Institute on the Ann Arbor campus, a bricks and mortar building. But they changed their philosophy to where today they prefer to fund programming rather than bricks and mortar. So they probably will not pay for construction costs that you might have for a project. So again, each grantor is different in terms of what are allowable costs, and you need to understand their guidelines. What I have here is a typical budget form. In fact, this is a standard form 424A. It's one of the federal government budget forms that you might be asked to use in writing a grant to the federal government. So this is a form, for example, that the EPA uses if you're writing a grant proposal to them. So it has particular categories: personnel, fringe benefits, travel costs, equipment costs, supplies, contractual costs, and construction costs. And so you'll get other kinds of costs that might not fill into one of these categories. You will total these items up to get your direct charges. And then most funders will also allow you to incorporate indirect charges, and we'll talk about what those are. But they typically also have specific guidelines on what they will allow to be charged into the indirect line. And some funders will have limits in terms of the percentage they will allow you to use as indirect costs that are fundable through that grant funding agency. So probably your largest cost is going to be your personnel costs. And so you've got to think about what type of personnel do you need to get the work done? And are they going to be full-time or part-time? Will they be funded by the grant or provided as an in-kind contribution to the grant? And by in-kind, what I'm referring to is that this is a person who maybe is already on your staff, is funded by a funding source already, but they might be working a percentage of their time on the grant project. What's important to understand is that some of the grant funders, a good example is the Federal Department of Housing and Urban Development, will require an in-kind match of a certain percentage. So you may have to think about, do we have resources that we can contribute to this project where we already have these funded resources or commitments from other agencies that can cover our in-kind match? And I'll talk a bit more about that a little later in the presentation. But it's an important factor to understand. Will they be provided by your agency or contracted through possibly another agency? So during the H1N1 flu pandemic, for example, we needed a surge capacity of nurses to assist us in giving flu vaccinations. We didn't have that capacity at the local health department, so we contracted with the Visiting Nurses Association to temporarily hire nurses that could go out into the community clinics that we offered to offer those immunization services. So that was a contracted line cost within our budget, and the personnel came from another agency. You can also think about, could volunteers reasonably be used for some of the activities? So we had clinics that we did, for example, around the community. Some of them were done at churches and at schools. And oftentimes you can get volunteers from schools. You've got students who have to do volunteer work, for example, for National Honor Society. They might assist with showing people where to park or handing out forms or simple tasks that still need to be done, but that free your staff up to do other kinds of important work. So thinking about volunteers is another important aspect. Now, I found a really good resource, which is the Federal Bureau of Labor Statistics, and I put the link here because in the course of writing different grants, I sometimes had to add new positions. So for example, while I was working at the health department, we added an epidemiologist. It wasn't a position we previously had at the health department. So we had to figure out what are the going wages, and the Bureau of Labor Statistics collects information nationally, and that includes information about average wages. So it can help you get some guidelines and figure out some reasonable costs to incorporate if you're creating, for example, a new position like an epidemiologist, to see about what the going rate is to fund that position. So I encourage you to take a look at the statistics that are available from the Bureau of Labor Statistics. It's also a great thing to use, for example, if you've got kids that are thinking of going into a particular field because it's got data on the likelihood that this is a growing profession or that jobs are in high demand or low demand. So it's a good tool also to use if you're mentoring students to help them get guidelines about future job opportunities. So how do we determine what we need? We need to examine the number and the types of program activities and the outputs in our work plan. So when we were doing the immunization clinics, we had to think about, how many we were going to do, how we were going to do them, how many nurses would we need, how many secretaries would we need to do the intake and the paperwork, what other kind of staff might we need for those projects, to figure out our staffing model. You also want to review the project timeline because that can give you some guidance in terms of how long you may need this particular staff person, and again, full-time or part-time during the course of the project. And another thing that we've talked about in previous workshops here is the logic model. The logic model can also assist you in evaluating activities in your plan and helping you to determine a reasonable staffing model.
Mark, we have a question.
Yes.
Someone's asking, do some grant requests require that you identify upfront how much personnel will be from your agency or contracted?
In some cases, they do. If you know the person or have the person on staff, oftentimes you will list that person on your staffing model. You may even include in the addendum a copy of their resume or CV to assist them in understanding who will be doing that work and what their background is. But again, that will vary from project to project and funder to funder in terms of how much detail they might want to see. Okay. So as an example, here we have a project where we're using a number of different individuals. We've got two engineers. We list their annual salary and the percentage of the time that they'll be spending on this particular project to give us an estimate of the cost that we want allocated to the grant. And this is one of the models that you can use. Again, we're listing just the positions, but some grant funders, if you've got the person already selected who will be doing that work, you might list the person's name, and again, include their CV or resume in your addendum. Another way to do this is to instead incorporate the hourly rate for that person and give an estimate of the number of hours that you anticipate they'll be working on the project, and then determine your personnel costs that you're anticipating will be allocated to the grant. So again, these are two of the common ways that we utilize to identify the personnel and the cost that we're requesting from the grant to support those personnel for the project. Now, another area that's going to vary greatly based upon your particular agency, and even within an agency. So for example, at the county, we had different bargaining units that may have had different fringe benefit packages. So typically you'll determine what the fringe benefit costs are for your personnel and use a factor to associate with that cost. The fringes can include things that are required by law. So for example, we have to contribute to Social Security. We have to pay workmen's compensation cost, unemployment benefit cost. But then depending upon the different bargaining units at our employer, we also had medical insurance costs, optical insurance, dental insurance, life insurance. We had a retirement plan, and the county also previously had a post-retirement benefit cost because they provided health insurance after retirement for some of their employees. So again, this will vary based upon your agency and the fringe benefits that are part of the package that you provide to your employees. So again, what is typically done is they add those all up and determine a percentage rate. So the percentage in this example is a 22% fringe benefit package rate. So you would multiply the 22% by the amount that they're paid, which would reflect an approximate cost for the fringe benefit package associated with that employee. Now, in this example, basically you've got one rate across the board. As I mentioned, at a larger agency like the county, we had different bargaining units, so there could be a different percentage based upon which bargaining unit they were in. Now, equipment is specifically defined and shouldn't be confused with supplies. And equipment is tangible, non-expendable property with a useful life of more than a year and a cost of more than $5,000. So equipment purchases are only allowable if short-term rental is not more cost effective. So you've got to kind of factor in, is this equipment we can rent at a lower cost, or is it something we need to purchase and can justify that we're going to be using it sufficiently to justify that cost of actually purchasing and owning the equipment. Service agreements that might be part of the price of the equipment are considered equipment costs, but separate service contracts should be classified under contractual line items on the budget. So I might purchase with, I'm trying to think, I think I have some examples. But again, you've got to look at what's the most cost-effective way of obtaining the equipment that you need. One example I can think of, when we did a lead reduction project through a HUD grant, we were able to obtain some equipment from the state, so we didn't have to purchase the equipment, but we had to pay a contractual cost for maintenance of that equipment. having it certified and verifying that it was giving us correct readings was done by an outside contractor. So again, the key to understand is that $5,000 cost limit. If it's above that, it's going to be on equipment line. So things like, you may need a laptop that you might think is equipment, but it's going to be in your supply line because you're probably not going to spend $5,000 or more for a laptop. You can easily get one for, around $1,000 or less. So therefore, it qualifies as supplies. So one of the things that I kind of learned by experience again was you want to make certain that you know and you follow the funder's rules and requirements. And an example that I have is we got audited by the federal government for one of the grants that the county received. And the federal government has very specific guidelines if you purchase something as equipment. So the federal guidelines required, for example, that you had a numbering system for any equipment purchases that were done using federal grant dollars. You had to account for the source of funding for purchasing that equipment. So was it all, one federal grant, or did, your entity contribute part of the cost? Who received the equipment? So was it, in the case of the Genesee County Health Department, we're an agency of Genesee County. So the title holder would be the county, not the health department, for any equipment purchases that we had. You list the acquisition date, the cost, the percentage of federal participation, where it was located. You need to keep a running tab of the condition of the equipment, so that ultimately, for example, if you've got a printing machine, let's say, that you purchased with federal dollars, or part of the cost was federal dollars, if that eventually breaks down, you have to list the disposition. It was traded in on a new model, for example, or disposed of in a landfill, whatever happened to it. You have to keep good records for federal equipment purchases, and again, understand what, if any, guidelines might come from other funders, and assure that you're following those guidelines. Because in the case of federal grants, there's a strong likelihood that you could be audited. You want to make sure you're in compliance with all the rules, because it could jeopardize future funding from that agency. It also could result in you having to reimburse them for not following their guidelines and rules. So here are some examples of supply cost. One of my best friends is a water quality specialist, and he does work with students across the state of Michigan sampling surface water. And he had a project here in Flint where he worked with the students in the Flint schools, and they did surface water sampling in the Flint River. In that grant to the EPA, they purchased supplies that included a peristaltic pump, a laptop computer for recording all the data and analyzing it. They had sampling supply kits and some disposable testing supplies, so some PCV gloves. Again, each of these had a unit cost that was under $5,000, so they were supplies and not equipment. Now, supplies and materials, you need to think about what kinds of things you might need. to perform the activities in your proposal. So for us, it was often medical supplies, and it could be disposable items or reusable items. So if we're doing blood pressure checks, for example, we're going to get blood pressure cuffs. Those are reusable items. But if we're doing diabetes testing at health fairs around the county, we had to purchase a testing machine, which was under $5,000. But we also had disposable test strips that were part of the supply. So you've got to think about that. You also might need cotton balls, Band-Aids, antiseptic. So you've got to think about all the different items that might go into your project and include those in your supplies and materials costs. You may also include office supplies. There may be print material, educational materials. You may need some books. So for example, when we were doing the blood pressure checks or the diabetes testing, we don't just give you your numbers, we'll give you a pamphlet that explains in more detail information about what those numbers mean, what you should do, ways that you can prevent getting high blood pressure, or if you're pre-diabetic, how to prevent it from advancing to diabetes. So again, you want to think about what are all the supplies and materials that we might need. Meeting expenses might also be part of the costs involved in the activities that you're doing. So you might have, if you're unable to obtain free space from a church or a school, some cost involved in renting some space. You may need to provide food or beverages. So, and this can be an item that may or may not be fundable. So federal grant programs, for example, many of them will not pay for meals. But I can think of an example, and I'm reminded because the person's here today, where we did a Heart Healthy event. The federal government would not pay for a lunch or a breakfast or dinner, but they would pay for the food that we needed to do cooking demonstrations. And then you could give out samples to the people that attended the event, along with recipe cards and things like that. So again, you've got to understand what is and is not fundable from your grant tour. Incentives are another item that can be very handy in improving your attendance. So one of the projects and grants that I got funded was to do breast cancer screening in Genesee County. We had challenges, particularly with African-American females tending to be screened at later stages of cancer, and then us having poor outcomes. So we wanted to try and bring more African-American and all women in earlier to be screened. We knew incentives could be helpful. I'm the perfect example here. I get my flu shot at Target every year because they give me a $5 coupon to come in that I can spend in the store. So I know incentives work for me and for other people too. We had some success when we had incentives available. But the federal grant didn't allow us to use any dollars for incentives. But at the time when we initially got the breast cancer screening grant, I was aware that one of the grocers in the area, Al Kessel, his wife had passed from breast cancer. So it was thing that he was very aware of and concerned about. And he had a mini grant program. And we applied to his mini grant program, and he provided us with $125 gift certificates to his Kessel grocery stores at that time, that we were able to use as incentives for women to come in and get a mammogram. So sometimes, you know, one agency might not fund incentives, but you might be able to find another one that will. So, and they can be very effective tools in improving attendance at your activities. There are other possible costs. So you might have some rent or utility charges, postage costs if you've got mailings associated with the work that you're going to do. There may be some technology and equipment that you need. So again, maybe you need particular software package because you're going to be doing certain kinds of specialized work, or particular kinds of equipment, be it a laptop, a desktop computer, a printer, testing equipment. You also may need marketing and media. So how are you going to make people aware of your program? This was often a challenge for me. Our state grants typically didn't allow for any money to be spent on marketing and media again. So we were very good at just issuing press releases. And when I was health officer, I used to regularly try to go on the local media channels to promote the different activities that we had going on. Again, you sometimes have to work with the funding agencies, or you may have to look to support from another agency that might provide you with some marketing and media opportunities. Again, I'll use the Al Kessel. When we did our breast and cervical cancer screening program, he agreed to allow our posters to be displayed in his stores. He also allowed pamphlets for our program to be distributed. And for a time there, he had his employees slipping one of our brochures in a bag of groceries if the woman looked to be 40 years or above. That might qualify for our program, just to get the information out there. So if the original funder doesn't allow for marketing and media, you can think about other opportunities that you might have to provide that service to get people aware of your program. Another common cost is travel cost. So the last grant that I participated on was a Robert Wood Johnson Foundation grant. They required us to attend a meeting once a year for the 3 years that this grant went on. So we had to build in the cost of our staff and the individuals that were involved in that grant, traveling once a year for a meeting with the Robert Wood Johnson Foundation and the other funded entities. Another type of travel cost might be mileage, and I'll talk more a bit about that, but it's a very common one that you want to try and incorporate into your cost structure. There could be training cost. When I was first hired into the health department, I worked in the area of my clinical background is in toxicology, and I became an EPA certified inspector to work in inspecting hazardous waste generators and Superfund cleanup sites. And so I had to obtain EPA certification. So there were training costs involved in sending me to special training. So again, if this is something involved in your grant or project, you want to incorporate those costs. Another thing that you'll commonly see is that the grant funder may want to have an evaluation component associated with your project. So they may want some analysis done to see how successful your work was. And in some cases, in many cases, the evaluation cost were contracted items because the agency wanted an outside contractor involved in evaluating the project. So there was no conflict of interest, and they were more assured that it was someone who looked at this from the standpoint of being an outsider and had expertise in doing evaluation. So we often hired individuals from our local universities who were outside of our agency to do that evaluation work, but then that was a contractual item on our line budget. Now, travel costs, if known, the applicant should provide a narrative description of the types and the purpose of the travel, estimated number of trips, planned destinations, estimated number of travelers, estimated per trip costs for the travel to trainings or meetings or conferences that might be involved with your project. And then you've got ongoing routine travel for things like site visits or inspections and similar activities that are local travel that can often be combined into a single unit cost. So here's an example of a travel budget where the travel costs look at individual trips. So you've got airfare, you've got your hotel cost for a certain number of nights, the taxes. Here at the university, we've got a per diem that we provide to each of the employees or staff who travel on university business. So each employee is paid a certain amount to cover their breakfast, lunch, dinner, and associated costs you might have, like common charges, internet connectivity at hotel, maybe a separate charge. You may have a rental car or Uber fees or taxi fees associated with it. So all of those should be collected so that you've got a good estimate of what, if any, travel cost might be involved with your project, so that, again, you get that funded through your grant. Mileage is another thing that if you've got workers who are working as part of the project and need to travel. So the examples that I have, some of our nurses did home visits. So travel from our office to each of the home visits was reimbursable based upon the mileage that they drove. So most agencies will use the standard IRS reimbursable rates, and the IRS calculates these each year. The rules specify, though, that driving from your home to work and from work to your home is not a reimbursable expense. So again, it's mileage while on the job. So a nurse who worked at my downtown office, for example, so that's her normal work location, I might have to send her to another office, like our Burton Clinic, where we did our immunizations. Back to school time, we would always get a rush. So her mileage from her normal location to her new assignment would be reimbursable. But if she left the Burton Clinic and then went home, that would not be reimbursable. So a nurse might be sent to training or a meeting in Lansing. Again, if it's work related, part of the program or project, it can be a reimbursable mileage charge. So contractual costs, here we'll assume your organization will hire 2 individual consultants and hold one event as examples of some of the common things that you might have in a project. We want to identify all the contracts that your project will require and add up the costs. So in this case, we've got 2 consultants, soil erosion consultant and a geographic information system specialist who's going to map out all the details for you. These are individuals outside of our agency that we contracted with separately to do the work. Training event cost, maybe you're going to, hire a speaker, again, someone outside your agency who's a specialist in a particular area to talk. You may need some audiovisual services, and you may provide refreshments at the event. Again, if we've had certain grants that would not pay for refreshments, so in that case, we may have charged a registration fee, a small amount to cover those refreshment costs. Other contracts, again, I talked about you may purchase equipment that needs to be calibrated. That's done by an outside contracted agency. You want to develop a contract and include that in your contract line item then to assure you're covering those costs. So for each contractual cost, you want to be sure your budget narrative includes the following information. So there should be a description of the scope of the work, the duration or period of time that you're going to need this person or this activity, and then what your procurement method is for selecting who's going to do this work. So at the county, we had a standard procurement policy. If we had a cost over $20,000, those items had to be bid out in a formal process. So we would do a scope of work, a bid out process. You'd have 30 days to submit a proposal, and then there would be a selection committee that would review the applicants and select based upon the lowest cost to get the activity done that meets all the requirements of your proposal. If we had costs under $20,000, the county's policy was that we get 3 independent quotes and select the lowest cost unless there was a justification for a higher item. So you might, for example, have a slightly higher cost, but that item came with a 5-year warranty, maybe where the lower cost did not. So some of those factors might change which item you pick. So your procurement procedures, again, they want to see that you've got competition. It's required for commercially available items and consulting services. exceptions can exist though, if you've got, for example, an item that is patented. So, you can only buy the Abbott laboratory testing machine for COVID is only produced by Abbott Laboratories. Items may be copyrighted, so you may want to use a particular media or materials that are copyrighted, so you have to use a single source for that. Or an equipment maintenance agreement might have to be with the original manufacturer of that item, because they're the only ones that specialize in the maintenance of that equipment. So again, there can be exceptions to competition existing for purchasing a particular items. Now, sometimes the grantor will specify procurement procedures, but more typically they want to be assured that you've got a reasonable procurement process similar to what I have discussed that the county had in place. So they had a procedure for purchasing based upon particular dollar amounts. And grant funders may vary in terms of what their dollar amount limits are. So they may have a bid out at 10,000 or above, for example. So again, you want to understand the specific guidelines for your grant funding agency that you've applied to. Sometimes the agency will have procurement procedures. As I mentioned here at the county, we had any item over 20,000 requiring a bid out process. Other purchases, we obtained at least 3 quotes and purchased the lowest quote meeting the requirement. Now, sometimes in some of our grants, we may have had a sole source justification. So we weren't able to bid it out because there's only one entity that can provide you with the item or the service that you need. So as an example that I gave previously, if you want the Abbott testing machine, you have to purchase that from Abbott Laboratories. If you choose to enter a sole source contract in excess of any grant purchase threshold, though, you must be able to justify the contract, and potential justifications can include that there's only one source for that item, as in the case of the Abbott testing machine. It may be an emergency situation. So if we've got a natural disaster, like a flooding occurring, or tornado just went through the Lake Fenton area, and you may need to contract quickly with tree cutting services, so you may not have time to bid it out. You can also get, and I recommend working with your grantor if you want to work with a sole source provider for a particular type of service. They have the final say, and by making them aware that you want to use a sole source, I've very seldomly had problems with the grantor understanding our justification and agreeing to a sole source contractor. You can decide and can demonstrate that the competition was inadequate after soliciting several sources. So one of the challenges, for example, we sometimes had was that individuals that put in a bid might not have met all the requirements. So sometimes we were limited to what ended up to be a sole source, only one applicant met all the requirements. So again, these can be some challenges. The best thing to do, though, is to work with your grantor and explain the situation in place and make sure they give the okay. Now, using an indirect cost rate, often an indirect cost will include a bunch of costs that can't be individually costed out in your grant proposal. So examples at the county, we had an indirect rate because there were certain things that were a cost to the county. We had to hire personnel. That's done through our human resources department. Any contracts have to be reviewed by the county's legal department. That was a cost to the county associated with the grant that would be covered by our indirect cost rate. So the county has a federally approved indirect cost rate that you could factor into federal grants. Now, one of the challenges here, and particularly with universities that tend to have very high cost indirect rates, is that some funders limit the rate that they're willing to reimburse for indirect costs. So I believe Ruth Mott Foundation has like a 10% limit on the reimbursable indirect cost rate that they will allow in their grant. That means that if you've got a higher indirect cost rate, you're eating some of the costs because they're not going to fund it all. And that's a very common thing. Many of the grant funders have a limit on their indirect rates that they will approve. So you need to understand that going in and make sure that you're willing to absorb those costs if they're less than what your calculated indirect rate is. So again, the rates have to be approved by the funder, and very often they limit the percentage that they're willing to cover in an indirect cost rate. Now, one of the things that we often had to factor into some of the work that we did was, can we charge for a service or bill an insurance company for what we're going to do to offset some of the costs? So an example that I have is when the chickenpox vaccine first came out, we had a child in the Fenton area who died from chickenpox. And so it was kind of big news in the community, and the local Kiwanis Club, one of their focus areas is immunizations. And they wanted to sponsor a special clinic in the area to make people more aware and to more easily access the chickenpox vaccine. So we can bill, insurance companies for the vaccine, but they wanted the clinic to be held not during our regular hours of operation. And our costs at the health department are based upon our normal operating hours. So the charges that we have for providing services are based upon those costs. So the Kiwanis Club worked with us and agreed to cover the cost for anyone who was uninsured, and they agreed to cover the additional overtime costs for our staff to do this outside our normal 8 to 5 working hours. So we covered the cost for the clinic by billing the insurance companies for those kids that had insurance coverage. The grant from the Kiwanis Club paid for anyone who was uninsured and couldn't be covered by any other program. And also covered then the cost for the overtime for our staff that were involved in the project. So again, you can't double dip. You've got to, cover your reasonable cost. But if you can obtain resources or revenue from the service, then it should be subtracted from the grant request that you're making. Another thing that you might be able to do is possibly charge an admission fee for an event or a registration fee that might cover parts of the cost. In some cases, you might be producing a product that could be sold. This is more common, for example, at universities where they're doing research. So I'll use my alma mater, the University of Michigan. One of my professors there developed the nasal vaccine for the flu as part of a federal research grant. The university then patented that and sold the patent to MedImmune Drug Company. So they created a product and sold the product. And so it's more common in doing research that this might happen. Are we producing or are there in-kind contributions from our agency or partner agency that might cover some of the cost? So again, this can be important if you've got a match requirement. So some examples of match requirements might be, for example, you could include if a church or school is allowing you space for free when they have an associated charge, like if you were using their rental hall, which they charge $1,000 a day for if it's a wedding or event. That might be an example of an in-kind contribution that your partner agency, school or church might be providing. Are you getting funding from another source? So sometimes, as in the example that I gave with the breast and cervical cancer screening, we got incentive dollars from another entity that was part of the project. We also could cost out things like media and marketing that might have been done and use, again, reasonable cost to help to meet a match requirement that you might have from a federal funder or other agency. Now, so cost sharing, matching funds, these are terms that are sometimes used for in-kind contributions. And again, many of the federal grants will require in-kind contribution or matching funds. You can't typically use other federal grants, and you've got to make sure that you're not over committing in-kind matches, because one of the things that we had to do when the health department was the provider of substance abuse services in Genesee County was we had to audit contractors that had federal dollar grants for substance abuse work. In one of the audits that we did, one of the funded agencies was committing staff time for a person that added up to more than 100%. That is a red flag. Again, if you're giving a supervisor to various different projects, there's only 100% of a person. They may have to work overtime, but that's not something you can incorporate into a grant. A person has to add up, a full-time equivalent is 100%. So make sure you're not overcommitting anyone's time to various grant projects to where it adds up to more than 100%. Now, there are uniform guidance that the federal government has that's part of the regulations. Cost sharing matches must meet certain criteria. The match must be verifiable from the recipient's records, not included as a contribution for any other project, necessary and reasonable to accomplish the project, allowable under cost principles, and not paid for by other federal grant awards except if it's authorized by federal statute. So again, you want to be careful that you're following all the guidelines of your grantor. So some examples of in-kind match, part of a project director who's already funded by your agency, but might have to be used for a percentage of their time to oversee the grant or to supervise the staff people working on the project. May contribute part of your staff time to the project. So maybe some of it will be paid for by the grant, and some of it is already covered by their existing salary. Other things that you can commonly use are things like space charges. So we did our clinics at various schools and churches. There are reasonable costs that you can get for rental space, $75 an event for 12 events. That could be considered then an in-kind match. When we did the HUD lead reduction project, one of the things that we had to do was move the families out when the lead remediation work was being done in their home. So we had a contract with hotels where they would charge us a reduced rate from their normal room rate. We could include as in-kind contribution from the hotels the difference between their regular room rate and the discounted room rate that they provided us as a charge for housing those families while the work was being done. You might also have, reasonable cost associated with volunteer hours for someone doing work for the project. But again, it has to be related to the actual charge of doing that work. So if I have physicians volunteering to do some work that is non-physician, like they're doing secretarial work or they're directing traffic for parking at an event for one of our clinics, I can't charge their physician salary. I have to charge what would be the cost of the work that they're doing. So if they're doing physician work, then it can be a physician rate. If they're doing some clerical work or passing out forms, it has to be a clerical salary rate of reimbursement. Now, there are certain unallowable costs, and again, this will vary. These are from the Uniform Grant Guidance for the federal government, and many of my grants were federal. So you cannot charge alcoholic beverages, alumni activity, bad debts, commencement or convocation costs, donation and contribution costs, development and fundraising costs, entertainment costs, employee morale, excessive employment recruitment cost, fines and penalties, goods or services that are for personal use, housing and personal living expenses, investment management costs, lobbying costs, membership costs, moving costs, student activity costs, and travel costs in excess of federally approved rates. So Again, understand what are allowable and unallowable costs, because particularly in the case of federal grants, there's a strong likelihood that you will be audited, and you want to be careful not to be in violation of any of their guidelines. This is an example of a private foundation grant budget that I use for a multi-year project, just to kind of show that it has a similar structure to what we saw in the federal form that I shared with you. So again, your staff position, titles, percent of a full-time equivalent, and again, this is over 3 years, consultant and contractual costs, and then direct program costs. Here they budgeted out items for like printing and postage, meeting expenses, supplies, travel, other. So you can see it's very similar, but again, you want to make sure you're using any required forms. In some cases, it may be open and you can use your own forms. But in addition to a written budget in a form like that, you want to have and will be required to have a budget narrative, and you want to make sure that you're following certain guidelines to make it easier for them to understand your budget. So it should follow the same order as the budget. The budget narrative gives additional details to explain and justify costs that are included in your budget. Does the budget narrative include only items allowable, reasonable, and allocable to the project? And again, you want to make sure it meets all those guidelines. Is the budget narrative easy to read? Short paragraphs, headings for the different budget categories that we have, again, specific to the form that you're using. Is the budget narrative concise? So many funders, National Science Foundation, for example, has a 3-page limit for the budget narrative. So you want to be very concise, but as complete as you can be. And then be really careful to make sure that the numbers in the budget narrative match those on your budget form. Again, it's going to send up red flags if you've got different numbers that can't be associated with each other. Now, in some cases, you may be a brand new agency. You don't have an accountant, or you haven't got standards in place for purchasing items. You may want to look at the possibility of a fiduciary arrangement. Various entities, universities, government agencies, the United Way, often will serve as a fiduciary, meaning a fiduciary is someone who manages property or money on behalf of someone else. So as a new upstart nonprofit agency that doesn't have an accountant on staff yet, is new to the work that they're doing, you may want to look at a fiduciary and create a fiduciary arrangement with an entity that has people in place that are familiar with accounting standards, has purchasing policies in place that can manage your money and work with you on your project to do the budget aspects of the grant. Again, budgeting is a process that I learned over 30 years of working on the front lines in public health. I learned from my experience and from the knowledge of others. This wasn't training I received while I was in university. I wished I had thought maybe to take an accounting course, but I did not. So I had to learn from doing. And for some of us, again, a simpler route might be to use a fiduciary to help us kind of learn the process and then develop our own system in place for our agency as it grows. That's my presentation. So I'll open things up to any questions that you might have.
Thanks, Mark. If anyone wants to come off mute and ask a question, feel free to do that. Or you can also drop questions in the chat and I can read those as well. I dropped a note in the chat to tell you all that we will provide you with some example budgets and budget narratives so you can kind of see how people typically do this. And we'll include some from different types of agencies, whether, federal grants may have certain things that they do, foundations may have other things that they do. So we'll give you a couple different examples. All right, we have one question in the chat. Aaron wants to know, what has been your biggest challenge or learning curve in writing budgets for grants?
Probably understanding what is and is not allowable. As working for a government agency, we also function as a nonprofit. So one of the challenges that I had was helping to establish what our costs would be, and detailing and documenting what those costs are. So how much does it cost, for example, for one of my nurses to do a vaccination? You've got a whole bunch of things you've got to factor into it. Not only the nurse's time, but there's the secretary's time and registration. There's a cotton ball, alcohol, Band-Aid, medical waste disposal charge, and all these different factors that you've got to include in what the cost of a service is, in calculating those individual things when they're parts of, the billing that you do, or, the funding for a project, operating as a nonprofit or government agency.
Yeah, I'll just add that for me, doing budgets, one thing that has come up, sometimes you'll submit a grant with a certain budget and the funder may decide, hey, we're not going to give you this dollar amount, we're going to reduce the dollar amount. And so you kind of have to work through where you can make cuts, which can be challenging. Another thing that might happen is that you get a quote for the cost of something, and then by the time the grant gets funded, the cost for that thing is a little bit higher. And so you kind of have to think about how to make adjustments, what you'll need to do to be able to pull off the work given those kinds of changes. And oftentimes you can talk to the funder, to kind of get their input on how things might shift, but that is definitely something that often happens, that you have to adjust your budget based on what you are funded to do.
That's a really good point. You want to have a good working relationship with the funding agency. Like, you'll typically be assigned a program officer who will work with you on your grant project, and you're going to have all kinds of things that come up. Like at the county, one of my biggest challenges was that during much of my tenure, we had a hiring freeze, which meant I had a long process to get a position approved. I would have a timeline for the grant, but then it could take longer to get the position approved, or we might have a challenge, for example, in hiring a nurse. So where on your timeline, you've got her starting after 30 days, it's 90 days before you've hired that person. So you want to work with your funding agency to adjust your timeline, or to adjust your budget, or maybe to allow you to use a temporary nurse, and switch contract lines. Typically, they'll allow you some leeway in moving dollars. Like the state of Michigan, for example, we could move up to $5,000 between lines if we justified the cost and got it approved by our the person who was overseeing our grant. So understand the rules, because nothing ever works out exactly as you planned, and plan on having changes. Develop a good relationship with your grant officer. And again, make sure you get everything approved.
All right, we have another question, Mark. Linda Gibson wants to know, do you have samples of procurement policies?
That's a good question. I just know the policies of the county, because I probably wrote over 50 grant proposals while working there. So those are the ones that I'm familiar with, but typically in some cases, the grant funding agency may have different policies. So I don't have anything aside from the ones that I've worked with at the county.
Yeah, and every organization is going to have its own procurement policies. So at a university, for example, at MSU, they have strict policies on how you can go about getting supplies and equipment. You may have to order it from certain vendors that they've already negotiated relationships with. There may be different dollar amounts that require different kinds of approval. Often that's more something specific to your agency as opposed to something that's specific to the funder. So that's just about knowing the rules for your agency. And if you're at a large organization like a university or a government agency, there'll be standard ones for your agency. If you're at a nonprofit, they may be different. They may not be as strict. They may not already have negotiated rates. But really that's going to be specific to your agency. And so you'll want to talk to the folks at your agency who sort of deal with those kinds of issues to find out what the policies are specific to your organization. Great question. Any other questions that we can answer? All right, I'm not seeing anything else in the chat. If anyone wants to come off mute, you can ask a question as well if you'd like. I'll give a couple minutes just in case people want to do that. All right, well, if there are no more questions, I want to thank all of you for coming today. We have a short evaluation that we would like each of you to complete. I dropped the link in the chat. Please let us know what you thought of today's session, any recommendations that you have for us as a group going forward, about other topics you'd like to hear about. I'll tell you that we also are planning to actually do a hands-on budgeting workshop for our next one, where you all can actually come in and we'll work with you in breakout sessions to develop a budget yourselves. So stay tuned for that. We want to give you all an opportunity to practice developing budgets because we recognize that it has a great learning curve, but it's something that is important and that anybody doing this kind of work should be able to do in the best interest of your organization. So thank you all for coming. And I'll do a plug as well for the HFRCC, the Healthy Flint Research Coordinating Center webinar starts at 12. So if any of you all are interested in attending that, they've been doing those every week since the start of the pandemic. So make sure you all check that out if you have any interest in knowing what's going on in the community related to pandemic and other community issues. Thanks everybody for coming. Bye-bye.